And they can come to me now and say, hey, like my sugars have been out of control. Like we have to do something, rather than kind of me being like, it's been 8 months, you really need to come in and what's going on.
Bowhead Futures presents Digital Health at the Front Lines. We explore how healthcare is shifting by deep diving with the doctors transforming the system from the inside out. Lots of different types of technologies that fit under this sort of digital transformation bucket. So I'd love to learn from you. What has been your experience, and what are you currently using today, or exploring today, or seeing today through your patients?
One of our biggest payers in the region has partnered with a company called Livongo that does sort of integrated diabetes management. It's a integrated monitor with an app that tracks their sugars, gives them coaching, automated coaching, and different levels. So some of it is just purely digital little reminders. Hey, did you think about this? Or wow, your sugars went up. Don't forget to track what you ate. So you can get some feedback on that. And then they also have in-person coaches, diabetic educators who follow up with people. So they're really doing that at scale. Right now, we don't routinely go into their portal and look at that. My patients will show me the results that they're getting because they're just doing it on their own. And our diabetes educators integrate with that program. So they are the ones going in and working with that, connecting that MyFitnessPal kind of tracking to the health system, and coaching and sort of these really validated and evidence-based programs like diabetes education are incredibly powerful and have had amazing results for many of my patients.
And as a clinician, how are you educated on this application that's coming to this world? You mentioned there are diabetes educators. And then of course, as a clinician, you still have to understand this app and the patient experience. So I'd love to learn a little bit more about that.
The nice thing about this is that because it was designed to be patient friendly or patient first, I don't have to understand that much about it. I mean, at first it was just patients being like, hey, I've got this thing, blah, something. And then they would pull it out and show me, wow, like all their sugars are tracked. And I see that they're getting, coaching. Wow, it links to their data for their last A1C from our EMR, that kind of thing. It was all designed to be integrated in that way. And they can come to me now and say, hey, like my sugars have been out of control. Like we have to do something, rather than kind of me being like, it's been 8 months, you really need to come in and what's going on, one of the ways that I think about it is I'm setting strategy, lower A1C to below 7% strategy, see a diabetic educator, and then the diabetic educators work on the tactics. How does this work in terms of your, 4 to 2 a.m. shift? And how does that work in the context of having to, drop off 3 kids at different schools and, be in the car while you're trying to eat? So that's the tactical level. And I think Livongo is really good at that. And then it can integrate into the strategy level when they see me.